live, Senator. Okay.
Oh, hang on.
Ready?
We're live,
Hold on,
yes.
wait.
Okay.
I'll let two more people into the,
Okay.
let me get in.
Good morning, everybody. We're going to get started in just a second here. We're still letting a couple folks in through the waiting room. All right, everybody's in now. Good morning, and thank you all for joining us virtually, and thank you all for joining us here in person this morning. We're here to talk about what we think is perhaps the most important bill that's going to come through session this time. It's 4344. It's known as the Foster Care Bill. It relates to child well-being generally as well. You know, this bill came out of the Children and Families Interim Committee, which Delegate Zukoff and I are both a part of, and Marissa has been intimately involved with as well. I actually asked to be appointed to that Interim Committee on Children and Families this year, and I'm very excited that we're coming to a place now with bipartisan support, and I want to give thanks. I want to give thanks to the delegates who have worked so hard on this bill and who have passed it unanimously in the House. I want to give thanks to Senator Rucker and Senator Maroney, who I've been working with here on the Senate side in a bipartisan fashion. I want to give thanks to foster parents, to local DHHR employees who are on the ground doing this very important, difficult work each and every day. So we're going to talk a little bit about 4344, this particular bill, what perhaps you're likely to see happen over the next couple of days, what some of the remaining issues to be ironed out are, and then we'll be happy to take questions about 4344 or more generally about other bills that are coming through the legislature. Delegate Zukoff needs to head to a House Judiciary Committee meeting, so
Thank you.
I think we've got a muted.
I'm sorry.
That's all right. Delegate Zukoff needs to head to House Judiciary, so I'm going to let her kick it off
Okay.
here.
Thank you, Senator Baldwin, and thank you, Marissa, for being here. Marissa's been a huge driver of this process, and I can't thank her enough. And I am remiss that I didn't thank her on the House floor when the bill passed, so my apologies, Marissa. But we started, as Stephen said, we heard all year in interim committee meetings about the issues within the foster care system and child protective services. And we formed a bipartisan group on the House side. Delegate Pinson and I from Mason, Delegate Pinson from Mason County, and I formed a bipartisan informal group on the House side, and we began working in the early fall on this issue. And so we came together and we discussed what are the major issues after we had our bicameral committee meetings. And out of that, we really realized that we don't have the data, number one, that we need to track the system, to make sure, to even know where kids are. And so we talked about what do we need in a data system for the legislature and actually for folks within those communities to know what's going on. We want it by county, we want to know by what type of foster families, we want to know who's with child placing agencies because they they represent the state in many cases. So we really needed to know that information. And we went so far on the House side as bringing in vendors to talk to us about other states and what they do and how that database can look and how it can work. And I have to give a shout out to Delegate Warbuck and Majority Leader Amy Summers for working with us in House Health to get this bill written and established. And we also realized that one of the major issues that we have in West Virginia is we have openings in the CPS positions around the state. We don't pay them enough for the job that they do. We have a huge turnover rate, and we have a huge retention issue. So this bill, unprecedentedly, gives a 15% raise and 20% in some cases to the folks that work in, those hardworking folks who have to go in and have a very tough job. They have to assess whether children need to be coming out of a system, out of their family's home. They need to understand in an emergency situation, where do they take them? Oftentimes they sleep with them in a hotel room or in their offices, and they aren't being paid enough for what they do. And it's time we step up to the plate. And I'm excited about that we're finally going to pay them. At least it's a start to say we appreciate what you do and we acknowledge that, and we want to pay you more. We also have been working, something that's not in the bill, but that I'm really excited about. We've been working with a group with the West Virginia Supreme Court. One of the issues that our Child Welfare Caucus came up with is that we have real issues with guardian ad litems in West Virginia as well. We have lost over 200 guardian ad litems in the last 2 years. Some of it because of COVID, but much of it because we don't pay them enough it harms their business, their own business, if they do this work. So we're going to be working, hopefully, with the governor's office and finance on both the Senate and the House side to see how we can come up with an additional $2 million to increase that rate of pay by $20 an hour on both sides of the work that they do. Those guardian ad litems represent the children in the process. And if we don't have enough, then the children's needs aren't being met, and they're not having the time to go out and meet with these kids. So those are some of the other issues we're working on. But I agree with Senator Baldwin. This is the most important bill that's going to come out of this session, in my opinion. And I'm so thankful that this is a bipartisan effort, that this is a bicameral effort. Both the House and the Senate recognize the importance. Nothing is more important in West Virginia than our children, and this bill puts them first.
Thank you. Thank you, Delegate Zukoff. And we're going to hear from Marissa here in just a minute, and I'll introduce Marissa. I just want to talk about a couple things that you may see when this heads to the Senate today. It's going to be taken up by Senate Health this afternoon. Delegate Zukoff talked about the data dashboard, and I think under Senator Maroney's leadership, you'll see some more specific details inserted in the bill today in terms of what that data will look like, what sort of data needs to be gathered for what purposes, and how that will help us in terms of meeting children's needs going forward. Another thing that I think you'll see in the bill today, and this is something that's been really important to me over the past year or so, there was an incident, and I've spoken with several of you about this. There was an incident in Greenbrier County. 5 children died. A medical professional made a phone call to the child abuse hotline. It was screened out. The local CPS officials and local law enforcement therefore never knew about that phone call from a medical professional. Right now, the bill has a study of the child abuse hotline coming over from the House. There will be a provision inserted today requiring that any medical professional that calls the child abuse hotline will automatically have their call screened in and sent to the local office for investigation. I want to thank Senator Maroney for his support of that. I want to thank Senator Rucker for her support of that issue over the last couple of months. I imagine you also will probably see some adjustments from the committee offered in terms of conceptual amendments. Senator Lindsay's here this morning. He's worked on this. He has a critical needs staffing component that could fit, I think, really well with this 15% raise that Delegate Zukoff was talking about moving into the future. You may see that this afternoon. So stay tuned to that Health Committee meeting. I think it will be important in terms of how this bill moves forward before heading to finance. I'd like to now introduce Marissa Sanders, who leads the West Virginia Foster, Adoptive, and Kinship Parents Network, and as Delegate Zukoff said, has been a really important resource and leader on these issues in the legislature. So, Marissa, do you want to chime in?
Thank you both so much, and thank you for inviting me to be here. And I will echo the same thanks to the bipartisan efforts on this bill, and thank you to Lisa or to Delegate Zukoff and Pinson for creating the caucus so that we could really dig into these issues and really understand how we can really work on the system and help make it better for our kids, because they're the ultimate goal here, right? So one of the things that we've talked, as Delegate Zukoff mentioned, one of the things we've talked a lot about is data and the need for more data in our system. This bill creates a data dashboard, which will help to drive transparency and accountability in the system so that we can really see over time, we can track trends in the system, and we can see how many kids are coming in and coming out, why are they coming into care, so that we can then get upstream and start to address some of those issues before they have to be removed from their families. The other piece of the data in the bill that I think is really important is we could be using data in a better way to help match kids with foster families when they do come into foster care, so that can help reduce the number of kids in congregate care. It can help to make sure that kids are really placed with a family who is prepared to meet their needs. whatever those needs may be. And so by using data to create a matching system where we can match kids and their needs with families who are prepared to meet specific needs, by helping the worker to identify which agency that they should call, which of the 12 child placing agencies may have families that could meet that child's needs. So I think that piece of the bill is really important as well. And I'm really excited to see the details that will be added today to the data dashboard. I think really getting a comprehensive look at the system and the trends over time will help tremendously. I'm very excited about how this bill can move us forward. So thank you both for your hard work on this and for sharing the information today.
Sure. Thank you, Marissa. All right. Are you okay? You have a little bit of
I
time
have a
to
few
take-
minutes,
okay.
yes.
Delegate Zukoff has a couple minutes before she's got to head to House Judish. But do we have any questions here in person or virtually?
Obviously, you're going to make some changes. You talked about some of the things that will be inserted in Senate Health. It's got to go to Senate Finance as well, so I know they'll peruse that. I know on the House side, it passed 99-1, so it had absolute near unanimous support on the House side. Obviously, you're talking to your colleagues over here. You can't predict the future, but what are your conversations with colleagues on this bill, and do you think it's got a good chance of making it over here as well, without being completely gutted?
Yeah, I absolutely do. I mean, I think you saw that near unanimous support on the House side. I can't imagine that you don't see that on the Senate side as well. This has been a real bipartisan effort, and as I said before, I think this is really a chance to get it right and to do some good things. And we do only have a little over a week left. It's just been crossover day. I think it bodes well that this is being taken up immediately. Obviously, there will be some changes, it looks like, that weren't in the House version. Sometimes that gives you pause, and is it really going to make it across? I think it will. I mean, this is a complex issue that we're just all trying our best to work on different parts of and see if we can get it right. So I am very hopeful that we can continue to work to perfect it and get it right over the next 10 days.
Delegate Zukoff, the guardian ad litem issue, why do you think it is important as, protecting the workers in the system?
Well,
and what bills would you, looking at there, and what specifically?
Well, we don't have a bill specifically because it's really a funding issue. The system as it is would work if we had enough people in the system to represent the children. For those who may not know, the guardian ad litem is assigned to the child, so they represent the interest of the child only. That's what they're recommend. That's what they have to do. They meet with the child. They meet with the family. If the child's too young, they're supposed to interact in the home. They're supposed to get to know that child, and doesn't matter what the parent, anyone in the system says, they're supposed to represent the child's interest. So our system, if we don't have enough folks representing our kids and their best interest, the system falls apart. And so it's really critical that we do something to increase the number. That system is paid for by the public defender system in West Virginia. So we're hoping that perhaps we can get a special allocation of funding through the budget or through the governor as a supplemental to, it's only $2 million. And the whole scheme of things, all the money in the state, that's a pretty small number. So we're hopeful that we can do that. I have to give the Supreme Court justices acknowledgement as well. They have been working on this. They have a pilot program going with the law school at WVU to have a class on child welfare issues, so that and they're also working on some programs where they can do a pilot program where some of their students can go out and work with guardian ad litems in the field, so that they can see this work and understand it, so that when they are hired in West Virginia law firms that perhaps they can do this work. And they're also working with, going to reach out to the law firms in West Virginia to see what we can do to get more guardian ad litems in the system. Maybe there's lawyers coming right out of law school. It would be a great way for them to get involved into the system to understand. So it's an effort, across the board to try to get more folks into the system. But we hear, they did a survey, the Supreme Court did a survey of guardian ad litems, and one of the main issues for those that are falling out of the system is they get paid very little, and, it harms their own practice. So, $20 an hour raise is nothing really, but we're hoping that it will be an impetus to start folks into the process.
You mentioned losing 200 guardian ad litems. Do you know how many are, registered in the state right now?
We have about a little over 250.
Okay.
And we
So
have,
you've lost about half.
yeah, and we have not quite half, and we have, around 6,400 children in foster care.
And
So, do the math, right? It's a big problem.
How many workers, this is a question for the CPS workers, but about how many would be affected by these pay raises? Do you know off the top of your head?
I don't. Sorry about that, I don't. Do you?
I'm
No.
sorry, I don't know this overall.
We'll figure that out.
Yeah. That was up to the finance committees.
Speaking of, do you guys fear that there may be a situation where the governor has to choose state troopers over foster care parents, or?
We surely hope not. We surely hope not. I think there's room in our budget for both. We have money at this time. What'd you say? No, okay. We don't have, I think both are a priority. We need our state troopers to help with this work as well. When we have issues, domestic violence issues in areas that aren't covered by, the work that they do, we have issues that they need to be involved with as well. So, they're part of the system as well, and it's time. We have to step up on both of these, in both of these areas.
And you said it's a 15 to 20% raise?
Yes.
So do you feel that's enough to keep these workers from going to, another state?
I don't know that it's enough, but I think it's a start, and that would be on top of the 5% pay raise that they're going to be getting anyway. So we'll see how that works, but it's a start. I don't know. It's kind of an unprecedented pay raise actually for one department of the state. So we're excited that people are taking it seriously enough to consider that large of a pay raise.
And that 5% is across the board for state employees?
It is. And I'm told, I haven't seen the budget yet, but that the specific pay raise bill addresses the school service teachers and school service personnel and the state police. And then the other pay raises are supposed to be within the individual budgets of the agencies that employ those folks. I haven't seen the House budget yet, but I've been told by Eric Householder, the chair of finance, that it's going to be within those budget line items. So I'm excited to make sure that that's in there.
Do you think this is the most bipartisan issue of the Senate, or of the session?
Yeah.
I agree. I do.
Yeah.
Yes.
I think
Yes.
so. And I just wanted to mention in response to your question, sir, I think this is going to happen. You asked, I think specifically, is this going to make a difference? 15%, is it going to help? I've been meeting with CPS workers over the last couple of months from the district that I serve to ask them that very question. What's going to help with this recruitment retention issue? And they gave me a list of things, all of which the department can do now. They could do on their own, and I've encouraged them to do those things. But they said, yeah, if we can do the pay issue, that's not going to be a cure-all, but it's certainly going to help. These are not folks who do this for the money, but it helps. And so if they tell me on the ground that this is going to help with recruitment and retention, then I think it's going to help with recruitment and retention. And in terms of your question, Joe, we've got the money, and these are related efforts. Law enforcement, for example, state troopers are working with CPS on a regular basis on these particular cases that we're talking about. And so, yes, this is a joint effort. We have the money. It's time to do it.
And in terms of impacting the child welfare system overall, having enough workers and enough guardian ad litems and enough of these really key people is really one of the biggest things we can do. Because that can help us to drive efforts toward prevention and keeping kids in their home, toward having more time for workers to work with families to help them reunify and make sure that they have the services that they need. To have guardian ad litems who have the time to go and see their kids and on their caseload and really help the family and understand what the child needs. And when we don't have enough of those personnel, that helps, that adds to all of these challenges. So it really is a top
I can
priority.
imagine, there's not much prevention effort, especially, kind of stopping after, kind of being a little too late. How much, will this help with just prevention and like,
It can help with prevention, depending on how we approach it. And certainly there are other things that the state does and could do more of that would help to prevent before CPS even gets involved. There are things that we can do to make sure that families are not struggling to make ends meet and experiencing inadequate housing and inadequate food and, loss of job loss and income loss. Some of the things that both lead to what can be classified as neglect, but also tend to drive up stress in families, which can then lead to other challenges. So there are things that are programs that are aimed at addressing those issues, and certainly we could do more of that and support those programs more as well.
And the more data we get, the easier it is to identify what
What the
those
issues
issues
are.
are.
Exactly.
And then work on it.
And that was a primary driver for me in looking at the data, was I want to know how many of our kids are in care, for example, because of inadequate housing. If we have that number, then the legislature can say, what do we need to do to address the inadequate housing challenges, the need for affordable housing, and where in particular, which is why we need this data on a per county basis.
Yes.
Because the affordable housing situation in Mingo County is very different than it is in Jefferson County. And how do we address that, and what is it that we need to do to get ahead of that so that kids can stay with their families? And
I don't have any more questions.
Were there any in the chat?
This
Bridget?
one? Yep. When will the raise take effect, and when will the data dashboard be up and running?
So the raise would take effect at the beginning of the new fiscal year.
Which is July 1st.
Yeah, data dashboard, I don't know the answer to that.
in the bill right now, it says October.
Yes. Yeah.
And can you clarify who will get the raise?
Yeah, it's an average, well, are you talking about, are they talking about the 15%? Did they say? Okay, I think the 15% is for social services.
Yes.
Yeah, so that's child protective services, adult protective services. The 5% is for all state employees, and it's average. And this would be 15% in addition to the 5% average for social services employees at DHHR.
I believe the bill currently says frontline workers, but it gives the department some
Some some leeway.
figure out who all
yeah.
that fits into that
Yeah.
category. Or direct service employees, maybe what it says.
Yes. Okay, thank you. I gotta run.
Yep.
I want to throw
Thank
a
you,
number
Lisa.
in that I know Senator Lindsay was talking with the press last week or earlier this week about the direct service number. I believe they told our finance committee 180 direct service workers.
Oh, okay.
Is that right? 180?
I didn't know.
Yes.
Yeah.
180, okay.
That are
Thank you.
currently, and there's vacancies, right? There's like 200 vacancies, so.
Yeah,
That's statewide?
180 workers, you said?
yeah,
That
that,
was, I think that was the.
That are considered direct service
Yeah, you're right.
childcare workers.
But overall. there was
180
more-
vacancies.
Oh, 180
Oh,
vacancies.
vacancies.
Okay.
Okay.
Vacancies.
that makes
awfully
more
low. I know we
sense.
have
That
to-
makes more
yes,
sense.
yes.
Right, 400 and
It-
something.
It's only
We have enough.
CPS,
Yeah,
I'm sorry?
it's CPS?
Yes.
okay.
That, yes, thank you guys.
Yeah, we got
Um,
that sorted out.
We do have another question in the chat. Broadly related, Senate leaders have raised significant issues about DHHR, expressed in a letter from Senators Baldwin and Tarr. The House passed with bipartisan support a bill to split DHHR into two agencies. Do you think these actions come from similar concerns about the agency?
I do. I do think this is related. There are financial concerns because DHHR accounts for such a large portion of the state budget. There are service-oriented concerns because Children and Families Committee, for example, feels like we could be doing more, or it's my sense, I certainly don't speak on behalf of that interim committee, but it's my sense from joining that committee that we could be doing more to help particular folks, children in particular. The recovery issue, substance use recovery, there's a sense amongst some in leadership that nobody's in charge. What are we doing? Who is coordinating all these efforts? Who's saying this program's working, this program's not working, and allocating resources based on that? I think there are questions about the direction of the agency and the nature of the leadership and the leadership structure there right now. So I do think all these efforts are related. I think it's important that we make decisions that are in the best interest of our citizens in the long term, rather than based on short-term personality issues. This is much bigger than any one person. This is a significant structural issue that has existed in West Virginia for decades. And so I think when we're making these decisions, we have to keep all that in mind.
Thanks, Joe.
Will the ombudsman changes stay in the Senate version? And do you all have any concerns about the language shielding ombudsman investigations from public records?
I think you'll see debate about that today in Senate Health. I think the ombudsman, and I can't ever say that word right, I apologize to Pam. I think she will probably be there with testimony about how she feels about that today, and the committee will likely make a decision. But that's one of those issues I think that needs to be ironed out in committee today.
Shall anyone?
I'm good. Thanks, y'all.
All right.
Thanks, Joe.
How you guys doing?
Thank you.
All right, thank y'all for joining online. We appreciate it. Hope y'all have a good day.
Thank you. Have a good day.
Tell me to be on the Senate Democrat, or Democratic Party. Or
Yeah.
put it up on YouTube later.
Okay.
Send out a link.
This will be up on YouTube later, and we'll send out a link if anyone needs to rewatch.
No, the only
Thank you.
choice could be between.
That's okay.
You decide what I'm doing here.
I think
I-
it could be the only choice.
But I me, I just stand there and wait and say so.
Are we done? Are we off?
Yeah.